Hello everybody, I am Dr. Tejaswi, consultant neurologist at Onus Robotic Hospitals. Today we are going to discuss about the brain-eating amoeba. The medical term for this amoeba is actually Naegleria fowleri. So it's a brain-eating amoeba because it affects the most vital organ, that is brain. And as it is vital, it is important to know how it presents and where it occurs and how to treat it. So we commonly see this bacteria growing in stagnated, warm water bodies, which is fresh body, like ponds, lakes and unchlorinated, unmaintained pools. So how does it enter the brain? It enters the brain via nose, because the nose has very free nerve endings which has direct access to the brain. So once we have the water in contact with the nerve endings, if the bacteria is there in the water, it is a direct pathway to the brain. Hence, even though the body looks stable, the brain gets affected within seconds to minutes. That is the reason it is very important to know these signs and symptoms, which can give us an idea that it is high time to go and see the doctor, because within days to less than a week, Naegleria can actually damage a huge part of the brain, and once that happens, it's fatal. So what are the symptoms of Naegleria or brain-eating amoeba? Starting from severe headache, confusion, blurring of vision and maybe seizures. Sometimes it can present with minor symptoms like hearing loss or tinnitus or giddiness, imbalance while walking. Even these are also important. If you notice any of these symptoms within days to less than a week following a bath in a pond or a swim, definitely you should be seeing a doctor. So can we cure it? Unfortunately, it is a very rapid, extensively damaging microbe, and the treatment for this microbe is also not as well established, and it is very resistant to multiple microbials. Also, the antibiotic or antimicrobials which we give, to reach the brain, it takes few hours, and within those hours as well, the patient can have huge damage within the brain cells. So what is the best solution? It is prevention. So how can we prevent it? So make sure that you never ever swim in an unchlorinated, unmaintained swimming pool. Stay away from warm water bodies which are not looking good, like ponds and lakes, especially in summer seasons, because they breed mainly in summers. Also, avoid rinsing your nose with boiled tap water. Try to use distilled water, and try not to disturb the mud in the bottom of the lakes, because that is the place where it actually grows. So even if you're going into such ponds, to prevent it from entering the brain, you can keep your chin and nose up and avoiding the water reaching high up your nose. Last but not the least, you can use nose clips while swimming or while taking a bath, which can prevent to certain extent only. Unfortunately, if the bacteria content within the pool is very high, these clips are not going to prevent completely, help you from infection prevention completely. Also, please follow the authorities around you and the hygiene. Please follow the authority commands according to the hygiene and the well-maintained ponds around you. Please follow the public health advisories about the qualities of the water bodies around you, and avoid them at any cost. Remember, small changes in your life and small precautions can save you from a fatal disease. So be very aware, be careful, be alert and stay safe.